There are mixed opinions about whether India should use herd immunity to tackle coronavirus. Experts also have differences of opinion on whether this will work for India or not. First, let us understand what herd immunity is. It is a controversial approach. It was recently discarded by the UK. Theoretically, this method relies on a majority of the population, about 60 to 80%, gaining immunity or resistance to the virus by becoming infected and then recovering. Herd immunity can be achieved in two ways. The first way is through mass vaccination, which for COVID-19 is still under development. The second way is through the infection, which means that a person gets infected and after a while they develop antibodies to fight the infection and thus become immune to it. A large number of people are asymptomatic, who show no symptoms at all or have just mild symptoms like mild fever, mild cough. Most of these people will recover from the virus without getting hospitalized. This will contribute to increasing the herd immunity. Herd immunity is touted as a possible strategy for poor countries with young populations such as India. But it is very risky because coronavirus is new and untreatable disease that is deadly. 3 reasons why herd immunity may not work for India and could be dangerous. First of all, the experts don't know a lot about COVID-19 immunity, especially how long immunity lasts, what kind of protection it offers, and whether reinfection is possible. Secondly, herd immunity is recommended for India because a majority of the population is young. It is believed that they may not get severely infected. But many of these younger adults may have dangerous underlying conditions and risk factors that could lead to severe complications and death if infected with COVID-19. Third, herd immunity cannot be implemented as a lone strategy. We need more hospital beds and increased cooperation between the public and private health sectors. And what would be the fate of the children, senior citizens, and those with weak immunity systems? For India, with such a huge population and limited health resources, it would be major risk-taking. But another section believes that by allowing the virus to be unleashed in a controlled way for the next 7 months would give 60% of the country's people immunity by November and thus halt the disease. Herd immunity strategy, it is believed, could result in less economic devastation and human suffering than restrictive lockdowns designed to stop the virus spread. For no country can afford a prolonged period of lockdowns.